Hi guys, Dr. Kid here. In this video, I'm going to review the medication Orlistat, otherwise known as Xenical or Alli, depending on which country you're in. And I'm going to give you an in-depth review on what you need to know before you start this medication. So what is Orlistat? Orlistat is a medication that's used for weight loss, and it does this by preventing us from absorbing the fats from our food. So how does Orlistat work? Well, normally when we eat food, we usually need to break it down in our gut so that we can absorb it and store it or use it as energy. For fats in our diet, our body uses a specific enzyme known as lipase to break down the fat so that we can absorb it into our body. What Orlistat does is that it blocks the activity of this enzyme lipase so that the body cannot effectively break down fats in our gut, and therefore the fat goes through our gut unabsorbed. Orlistat reduces the fat absorbed in our diet by approximately 30%. So who should not use Orlistat? Well, patients that should not use Orlistat include patients that have any type of chronic malabsorption syndrome, meaning that they cannot absorb nutrients effectively, that have any pancreatic disease or pancreatitis, any sort of gallstones, the medical term which is cholelithiasis, or any bile duct disease. In medical terms, we call this biliary disease, or anyone that has had recent major surgery to their stomach or their intestinal system. Now, because Orlistat inhibits the absorption of fats in our gut, it can also interfere with a lot of medications as well. One very common medication that is interfered with by Orlistat is the oral contraceptive pill. This is because Orlistat can commonly cause severe diarrhea, and this will reduce the absorption of the oral contraceptive pill, making the pill potentially ineffective. Some other medicines that Orlistat interferes with include cyclosporin, which is an immune suppression medication usually used in transplant medicine, amiodarone, which is a medication that's used to control heart rhythm, warfarin and other blood thinning medications that's used to thin the blood to prevent clotting, and also acarbose or other diabetes medication that's used to treat diabetes. There are many more medicines that potentially Orlistat interacts with. This includes HIV medication, medications to treat epileptic seizures. So it's really important that you tell your doctor all your medicines when you discuss this medication and make sure that it's appropriate for you. So what are the side effects of Orlistat? Well, the most significant side effect to be aware of is the severe diarrhea, oily and smelly stools, and increased urgency to go to the toilet when using Orlistat. This is because it's preventing all the fat from being absorbed in your gut and it's all coming out the other end. Other side effects include nausea, indigestion, abdominal pain, bloating, and gum disease. So how do you take Orlistat? Well, Orlistat comes in a 120 milligram capsule and it's to be taken 3 times a day with your meals. Now, it's important to only take Orlistat when you're eating your meals, and if your meal has no fat in it, there's actually no point in taking Orlistat at all. Because Orlistat inhibits fat absorption, it's recommended when taking Orlistat to supplement with the fat-soluble vitamins. These are vitamins A, D, E, and K. So does Orlistat work? Well, to give a really rough guide, you may expect to lose between 5 to 10% of your body weight if you use this medicine for up to 6 months. However, this is only a very rough estimate, and it's very difficult to determine how much weight loss you will specifically have with this medication. This is because there's so many factors that come into determining how much weight someone loses when they take a specific weight loss medication. Some of the factors include how long you take the medication for, how well you tolerate the medication, specifically for Orlistat, how much fat you already have in your diet initially when you start taking it, and also how committed you are to diet and exercise, obviously. In my humble experience, I find it's slightly less effective than other weight loss medications that suppress your appetite as the mechanism for weight loss. This may be because it only inhibits fat in your diet, and you can still get a lot of calories from other aspects of your diet, such as sugars and carbohydrates. The main reason I see patients stop this medication is because it does cause severe diarrhea and foul-smelling stools that they cannot tolerate. However, there are other patients that does work well for because they find these side effects really deters them from eating fat, and therefore they reduce fat in their diet and they lose weight. So if you're interested in this medication, make sure you see your doctor to see if it's appropriate for you. Now, if you're watching this video, I'm guessing that you're considering using some medication to help you with your weight loss. If you want to know some of your other options, I'll leave some links in the description below on some of my other videos that review some other weight loss medications. But as always, if you found this information helpful, please help me out by giving me a like and subscribe, and I'll see you in the next video.